the gift has two parts. The first one is really providing additional support for all the work we're doing under the Institute for Hope. So dealing with a lot of the social determinants of health, having innovative new programs, utilizing virtual care to be able to improve the health of the community. And for Bob and JoAnn, they wanted to focus on communities that don't normally have access to this type of care. And the second part is really to recognize nursing as a profession that is critical to that healthcare transformation that we're looking for. JoAnn, as a nurse, understands that, and she wants to make sure nursing is recognized as a part of that future of healthcare delivery. So it turns out there are a multitude of forces that creates that life expectancy disparity we see from in zip codes. It's not just violence, which is what a lot of people want to attribute this to. The biggest issue is chronic stress, right? So how do we assist individuals to reduce that? How do we give them pathways that they can follow, that they can go on their own to be able to lift themselves out of this chronic stress situation? We see that in infant mortality, for example. African American women have much higher rates of giving birth to babies under 22 weeks of gestation. And that hence creates significantly more infant mortality than for other women. So we have to get away from this chronic stress. We have to be able to identify it early and help people be able to cope and find ways out of the situation that they're in. That requires education, that requires health monitoring, that requires support in career planning and being able to get better jobs, that requires virtual behavioral health, mental health, that requires addiction treatment. It requires for us to make sure that we have ample supply of healthy food for them, all transportation, all of those different things. So we're looking at our neighborhood, the Clark Fulton neighborhood around MetroHealth, as really the model that we want to implement all of these in. Now, it's important to note that all of these things have been tried before at different health systems to various degrees of success. We know of no other health system in the entire country that said they were going to tackle each one of the social determinants of health at the same exact time. So that is, I think, what Bob and JoAnn want to invest in, is to see if this innovative approach of holistically taking care of everything is going to be the answer for the transformation of medical and healthcare.